Good afternoon to the few and the proud, right there. I know as well as a lot of you here, right? The temptation, you look at your phone, maybe you just happen to peek and see how I-35 or MOPAC is looking right now, and boy, there's a lot of green. I appreciate, why you're staying, and I like to think it has a lot to do with me. I'm smart enough to know that it has nothing to do with me. But it's a testament, right, to our afternoon keynote, Dr. John Zerwas. These forums where we bring together smart folks to sit out there, right, there's an obligation for us to make sure that there's something to fill up the cup up here, right? And, when you write down some of what does the resume or CV or experience look like? Let's see, medical director, physician, former legislator, former budget chairman, current executive vice chancellor for one of the largest health systems in the country, if not the world. I think we did our job. So I am really, really pleased to have Dr. Zerwas join us this afternoon. I would love for this to be very conversational. It's a short time. As a housekeeping note, the only thing in between you and beer and wine and fancy snacks outside is actually the next 30 minutes of really good conversation. So we can absolutely, we'll turn this open to question and answers, and so I would encourage you to be thinking of some of those now. I kind of want to start with, you were obviously on the inner circle within the governor's response to COVID, and would love to just get, your sense of what that experience was like, really from a more personal perspective. We got to hear from Dr. Hellerstedt and obviously a lot of the response on the ground, but what was it like to just be part of that response, and what did that mean for you?
Well, not sure if there you go. Well, thank you, Carter. Thank you all for having me. I appreciate it so much. I've had the opportunity to work to be part of this organization in the past, as a legislator, and as a non-legislator, I have to admit it's pretty nice to be here, and I'm not over in the pink building right now and stuff. So, but I was at the time I was the executive vice chancellor, just newly appointed actually for the role that I was in, and I can remember distinctly being at home in mid-March, and I got this call from Luis Saenz, who is still was the chief of staff for Governor Abbott at that time, and he said, Zerwas, we want you to come to be part of a strike force response team and work with the governor and the Department of State Health Services and Texas Division of Emergency Management and be part of this strike force response team. And I'm sitting here, I think my life's changing, okay? And when the governor calls, you go do the work. And I was very proud and honored and privileged to be in his, book there to say, we think you have a role to play in this, so come join us in this. And so I did, and joined a couple of other people that were from Dell Computers that came also, and really we had a charge to come up there, to do a couple of things. One, the Dell folks says it was to go find PPE, and if you remember all of that, and Commissioner, I remember it well, that was a desperate period of time that we were struggling to find, these pieces of personal protective equipment, to make that happen. I was personally given the role to work with some of the folks in the commission around the capacity across the state of Texas, our hospital capacity. In other words, if we were going to be actually bombarded with this pandemic, did we have the capacity to respond to that? And went through a very, very good exercise with that early on. We figured out what we needed to do. And, I stayed embedded with the commissioner's team for Wow, it seemed like forever, John, but day in and day out, we would come in, we would have the same meetings, we would hear a lot of the same reports, And then we would go do our day, and then we'd have those same meetings in the evening. And it was just every day, any day, every day was the same. You lost track of weekends or anything else, but everybody was there really working hard, trying to battle something that we didn't have a prescription for. We didn't have the recipe for how to, fix these things or take care of this. There were a lot of things that evolved over a very short period of time. There was a lot of things that were tried, and some worked and some didn't work, but it's a very, in a way, it was an incredibly exciting time to be in the midst of healthcare and the practice of medicine, because you could completely open up your ingenuity in terms of looking at how do we respond to this thing that, for at least right now, we don't have a good remedy for. And so very, very exciting. And some of the ingenuity that came out of our health-related institutions, our higher ed institutions was fantastic. I mean, just people coming up with, we're going to run out of ventilators. How can you come up with a real simple, reliable ventilator? And boom, they came up like that with these devices and things. Fortunately, we never needed them. That was one of the things we didn't run out of, So, but it was just incredible, the thought and just ideas that came out of how do you respond to something like this. I look at my I guess what's now 43 years. I've been in medicine since I was licensed as a physician. There was no greater challenging time, and there was no more exciting time, to actually be in the midst of healthcare than that time. So,
and knock on wood, hopefully there isn't.
I'm going to not do it again. Yeah, one time's enough, but it was exciting.
Who served, it is a career and hopefully a generational event. So fast forward, you've been in your current role with the University of Texas system. Throughout the day, we've had sessions. They've come up in others. They came up in a state legislator session. They came up in a federal policy update session. They have come up elsewhere. Is workforce. It's just right in the middle of everybody's kind of radar. And you find yourself now in a role where you have direct kind of impacts, levers and buttons and things like that. And so would love to hear kind of from your perspective where the focus is and what's going on there.
Yeah, it is. And as you may recall, last night at dinner, that was one of the things I said keeps me up, along with cybersecurity, so it's kind of two different things, but they're things that kind of make me sweat before I go to bed and stuff. And the workforce is a challenge that everybody's realizing right now. Part of it is burnout, part of it's the Great Resignation, part of it is just the fact that we've never really been where we needed to be in workforce. I mean, I can remember for all my years in the legislature, we were trying to do things to enhance the production of nurses. And we graduate thousands of nurses every year. We have some of the most robust nursing programs in the country, but yet we still can't keep up with what the need is out there and so forth. And part of that is turnover. Part of it is people leave the bedside. Part of it, people go into the critical care setting and then they leave that and so forth, And so, but what can we do really to enhance the pipeline? Okay, we got a pretty good pipeline, but it's not adequate. What can we do to perhaps redefine how we deliver care at the bedside, in the ICUs and things like that, so that we can reduce the demand on the manpower per se? Lots of activities going on in that area. And what can we do to address the issues of burnout, the things that just finally drag people down, that they just no longer want to do this job. And, personally in our area at UT, we've got some groups working on that, specifically working on that, coming up with some very, measured ways that you can kind of address this, not just among physicians, but through the entire workforce. It's something that bleeds into everything that we do. When you come out of such a stressful experience as the pandemic imposed upon those people that are involved in healthcare, you just pile on what is already a pretty stressful job.
Yep. So. Yeah. Are there areas within graduate medical education or residency policy or things like that you have particular kind of interest or attention in, or kind of what keeps you busy in the 9 to 5?
Yeah, sure. Graduate medical education is probably the best thing, at least from a physician point of view, that we can do to try to enhance the pipeline of physicians. Texas is a very business-friendly state for physicians, as I think most of us will recognize with some issues in tort reform that occurred back in 2003. And so we've had physicians that really want to come to the state, but training physicians and getting them to stay here is kind of what we really want to be about doing. So back in, it was maybe 2013, I was working with Senator Nelson at that time, and we were working on the Article 2 budget and things like that. But we were also very focused on what we needed to do to have graduate education slots for physicians based on the number of doctors that we are actually graduating. And the number was 1.1 to 1. And we were able to find money and push it towards that, so that through the coordinating board, you could actually push these grants out to various locations that wanted to beef up their GME programs and stuff. Because as you know, Medicare pays for a vast number of those, but you cap out at some point with that. And so there hadn't been a lot of success in getting some enhancement there. I should have asked Seema that question when we were in there in that last thing, to say, hey, what do you think about that? But truly, enhancing our GME is a way to not only make sure our graduates have that opportunity for their postgraduate education, but also to attract others to come. Again, it's a very, very physician-friendly state from that standpoint. And we have huge, incredibly good opportunities for different kinds of GME education and stuff. And the area that, obviously, that I think a lot of us talk about is in behavioral sciences and psychiatry and so forth, and have been a number of efforts to try to enhance that pipeline. And one of the ones that I like to highlight is in Tyler, Texas. Believe it or not, it's one of the more robust programs for training psychiatrists up there and stuff. And East Texas happens to be also one of the areas of the state where we have the greatest need for physicians in general, but certainly just as across the entire state, mental health professionals and stuff. So there's certainly more demand for different kinds of specialties out there, but programs have been in place to try to enhance people to go into these high need areas and stuff. So.
Very good. So you mentioned, obviously, in a previous life, your work with the state legislature, and obviously one of the roles that you were able to serve there was as a appropriations chairman. As it's been discussed, Texas is in a budget year, and they have found themselves with a surplus. Yeah. It creates kind of a different dynamic, and I wonder if you would shed some light on kind of some of the dynamics there, and obviously the magnitude of the surpluses hasn't at least been seen in recent history, if ever.
It's never been seen, actually. And in 2019, I thought we had a big money year and stuff. It pales in comparison to this, but we had just come out of in 2017, a year where we had no more money than we had in 2015. So we were going to have to keep everything the same, despite the fact 1,000 people coming to Texas a day and really seeing an increased demand in services. So we went from, a 2017 year where the answer was no to everything to 2019. Hey, we got some money here to do some things, and we did. We had a great budget year that year. It was a privilege to get to work with the team that put that all together. I think one of the most telling things to me as to how quote unquote good that budget was is we'd passed it, we'd got it out and everything, and as of course we know, it goes to the governor and there's potential for vetoes, and he can line item issues in the budget, and it typically always has. Perry and all of them before that had where they had line item veto authority, they did that and stuff. So I remember sitting out enjoying the fact that I wasn't in the legislature out by the pool with the grandkids and stuff, and I get this call on my phone from Luis Saenz, and he says, hey, the boss is trying to call you. I said, okay, all right. So I get out of the pool, dry off a little bit, it says no caller ID. I know immediately who that is. Both Commissioner and I know that. You pick that up very quickly and you say, yes, sir, And so he talked to me about it and he says, John, look, I've got a pile of proposed vetoes a foot high on this bill. And he says, I just said, we're not going to veto anything in this bill. Pushed him off to the side. He says, I am going to sign off on this bill exactly the way it is. And that sounds kind of silly to probably a lot of people to appropriate it. I mean, that just makes your heart sing, to say that, okay, fine, we worked this hard to get these things in place. The governor was very much looped in on a lot of the decisions that were made and so forth. And it was just a very rewarding and gratifying thing to see that. Now, it's not a $30+ billion surplus, that's a whole different magnitude. But when it's not this dissimilar from 2019 in this regard, in that, you got $30 billion, but you got $100 billion in asks, Well, it's the same kind of thing. And, although it's easier to budget in a lean year, frankly, because the answer is no to everything, it's harder to budget in a surplus year, but it's much more gratifying. Yeah. It's the work that you're able to do to really put money behind policy and bring it to life it's more work, and you have a lot more conversations with people, but it's work that gets done and you enjoy doing it. So
I do think a misconception for those who haven't lived it, myself included, right? The premise that, it's very hard to tell people no. Well, it's harder to tell people no when they know you have money, right?
Exactly.
They can't hide it.
Yeah.
They've got a lot of money this year.
Yeah, exactly.
So with that, one of the things that has always kind of been floating around the surface and not so quietly, right, is Texas still really, really struggles with the number of uninsured Texans, struggling to get access to health care and how they access it, obviously being riddled with inefficiencies and really driving to more costly sites of care and things like that. And as a physician, you're acutely aware of that. Is there, is there opportunities or is there perspective for the ability for the legislature to do meaningful things to that end? Obviously, Medicaid expansion has become this toxic phrase that can't be uttered in the hallways at 15th and Congress. Are there other things or other opportunities you think that the state legislature could take advantage of and potentially get the governor to endorse?
Yeah, well, I think there has been some partial success with that. What I will say, just to revisit the whole Medicaid expansion, I carried a bill in 2013 that would have allowed us to, we phrased it something different than Medicaid expansion because that was a death knell to say that. And so, but if you could say, okay, look, we're going to put together, something hopefully that is considered, I'd probably call it Texas way or something corny like that. And so but what we did was we put together all the things that basically, in a conservative playbook, frankly, that you would do if you had a block grant for this population of patients, of constituents. And so it truly was totally framed that way and said, we expect all the things that you would do and would have the ability to do, if you had somebody in this particular cohort of people, which is about 1 million to 1.5 million people, the people that fall in the crack for which there's no solution. And that's the thing that I think that we really have to decide, or our legislators have to decide, and others, is there a will to address this? Because it's a real gap in terms of people having access to care. Now, it's not the total remedy, be sure. If you figure you got 6-7 million uninsured people out there, 1 million of them are undocumented immigrants. Yep. There's not a solution for them, okay, except over in the public free clinics and things like that. They can get care, clearly, and they do, but they won't be a solution like this. You got at the other end people that just choose to not get health care insurance, or they're young, they're immortal, and they don't feel like they need it, and so forth. Now, there's laws that say they need to have it, but that's another question. And then you've got this group of people that for which there isn't a solution. Even if they had the money and stuff, they can't find a solution out there. There's no more cost-effective way, in my mind, to provide that slice of the uninsured, the comfort of having health insurance than what's offered in the expansion grants. Basically a 90% in perpetuity match to your 10%. There is not a lot of programs out there like that the federal government is willing to do. There was the comment when I first carried it 10 years ago now that, well, we don't think the federal government's going to live up to that. They're going to pull the rug out from under you, and then what do? You're back to the old 60-40 match and stuff, and that costs you a lot of money to run that and stuff, So that didn't happen. We have a decade's experience with it now, and it didn't happen and stuff. So but you're right. I don't think the political winds are there, and I tell people that all the time. I said, you can make an incredibly conservative argument, not only in the elements of what the program could look like, but what the cost effectiveness would be, especially if you live in a hospital district where a lot of your tax money is being pushed towards care for the uninsured, because they don't have the hospital district doesn't have any way of picking up any money for them. So it goes to the taxpayer ultimately. And so if you want a good argument, any elected person say, I'm going to try to either level off or drive down your property taxes. That's the story, let me tell you. But it's not made up, it's true. Yeah. To the extent that you have that burden out there and stuff. So. But anyway, I do think that, we got 6-month extension for Medicaid mothers. It should have been a year. I think they do get that this year. I think that's clear. That's something that can happen. There may be other sort of programs out there. I think there may be some things that also address certain other kinds of diseases and things like that. The legislature likes to focus on certain diseases and things. I carried the renewal of CPRIT in my last session to push that for another $3 billion in research and prevention and so forth. A fantastic program that everybody gets behind and is actually doing some incredibly great things in the area of cancer research and stuff. But cancer is not the whole story, in Texas. If you look at the things that would really improve the health of Texans, are things that we've been struggling with for quite a long time. It's tobacco, it's obesity, and it's all the consequences of obesity. It's diabetes, and people not having access to the kind of good maintenance care that they need. All these things are things that can be very effectively treated and stuff.
Sure. I would love to open it up. We have the same mic stands out, and would love to hear questions from the audience.
I think the commissioner has a question.
Oh, here we go.
I see him. Yeah. I see him moving.
This is your chance. You really get to nail him to the wall now, John.
It won't be anything new. There's not anything I don't think we know about, don't know about each other after that many days in the trenches together.
In the bunker. That's right.
It's true. We got to know each other. I just want to know, what is your recommendation for footwear if you want to go to the Capitol and have influence with people? Is it strictly Western boots? Did I go completely wrong with my tennis shoes?
I think Western boots with the seal of the state of Texas on there, and put your name above it too, and I think that's a real sign that you're really into this,
All right. How big a hat, too?
Didn't we talk about that at one time? I thought I told you what the size of the hat you needed.
Well, I just want to say kudos to John Zerwas. He is a mensch, and having spent the time with him, all of the good vibes that you get from talking to John Zerwas are sincere. They come from his soul. And we're very fortunate to have a public service servant like John. And he and I were part of sort of a 4-member group of doctors that advised the governor in the dark days of the pandemic. And the governor got very good advice from us. And one of the things that I probably should have said this morning, I'll say now, the governor's a quick study. The governor never pushed back on the science. He always understood the science. There was not an argument about that whatsoever. But he did what I think is the ideal paradigm for how to deal with these sorts of things. He got good advice and he made difficult decisions. And we got to where we are today. But I would just want to thank John Zerwas again. What a marvelous human being, and what a privilege to get to know him.
Very kind of you, Commissioner. Thank you for that. And obviously, I echo those feelings about you. You know, we had some long times where we talked about just what seemingly were some of the most mundane things, you know, when we were trying to position the governor to open the economy. You know, we tried to go through all the things to the best of our knowledge that would need to be done to open theaters, to open the restaurants, we even talked about opening the bars, and we did open the bars, and then we closed them down, you know, and stuff. And so, but, you know, it was one of those, it was hard work, but it was, you know, just such a great time to be together trying to figure out how do we bring the state back. If I look back, you know, Commissioner, on some things that I would say we would probably do different, and Texas actually did pretty good on this. A lot of people don't realize this, but you know, the degree to which we shut down the economy was frankly probably not necessary. And I think there were real, you know, there were really important things that happened as a consequence, some mental health things as a consequence of that. And we started to deal with, you know, an economic, you know, emergency, as well as the emergency related to the virus and stuff. And in hindsight, I would say, even though once we opened up our economy, even during that first peak, we never shut it down below 50%. And a lot of people don't know that. We maintained it throughout, you know, the worst days of the pandemic, and then, you know, once we kind of rallied to a point where we could get it fully opened, we did, you know, and stuff. But that was something that the commissioner and I and a couple of other physicians, you know, were very closely involved with the governor. And I remember the commissioner's statement, and it's so true. You know, science can advise, but we can't decide. And you know, really, frankly, the hard decision is the deciding, and that falls right in the lap of the governor in this case, in light of where we were and stuff. And so, you know, again, the governor is a very quick study. You know, is totally dedicated to the health and well-being of Texas, and you know, we did the best that we could. I think in hindsight, we could have done some things different, but I think all in all, based on what we had in terms of information and science, we made it work. So,
very good. Others? You're going to have to tap on a mic or something because the house lights are. Here we go. Here's a brave soul.
I wanted to just echo Dr. Hellestat, Dr. Zerwas, just say thank you for remaining public-facing and approachable and sincere. You know, really appreciate what you've done for the state throughout the time that we've known you here. My question is a little bit more wonky out of the leadership perspective. You know, you said what keeps you up at night is both, you know, the labor force shortages that we're having, as well as IT security, right? Well, it seems to me that the nexus of that is interoperability, right? How you can support your staff that's out there, but yet keep things safe. Working for the system that you work for, the large system, what kind of things you see coming up down the road? We haven't talked about interoperability in a few years that are on cutting edge that you're seeing that's going to help with this.
Wow, yeah, it is a wonky question, and and I don't have a wonky answer for that. You know, what I would say is that, you know, because we have become so dependent on technology for the effective and efficient delivery of care, as well as for our research industries and things of that nature, you know, the vulnerabilities is what really, you know, keeps me awake. And you hear about some of these where hospitals are just totally shut down, you know, as a consequence of malware and things of that nature. You know, having, you know, more than a few hospitals in our healthcare system, understanding, you know, how much that would bring things to a close. You know, the ever vigilance on that is just so important, you know, and we have people that they talk about this, and when I'm in meetings with them, I ask them that question. I say, how do you sleep at night? You know, this is just something that is always there, and it's one click away from something happening. You know, it's going to, you know, really make things very, very difficult. Now, in terms of your comment on interoperability, let me just say this from the standpoint of where we are in terms of electronic medical records and so forth is, you know, we have an incredibly big investment in Epic, you know, as our electronic medical record throughout, you know, our major health-related institutions and stuff. And that's probably, you know, our venue for increasing interoperability among our different institutions. You would think that, oh yeah, that's a natural, that should have happened. But no, it doesn't. They're all separate instances with Epic and stuff. And so, you know, trying to have that ability to create that interoperability and that ability to really, you know, work with, you know, the ready availability of patients' information is a place where I think that we can improve significantly. But you know, when you look at the potential opportunities for bad players, you know, evil players to kind of jump into your the integrity of your IT, you know, and potentially, you know, hold you hostage or steal secrets and things like that, it's a pretty concerning thing.
So I think with that, I think Dr. Zerwas was a great kind of capstone for the day, and would ask you to join me in thanking him for his time and his comments, and with that, we'll be adjourned.